Coagulants. Coagulants are substances that promote coagulation, and are indicated in hemorrhagic states. Fresh whole blood provide all factors needed for coagulation and are the best therapy for deficiency of any clotting factor. Other drugs used to restore hemostasis are vitamin K: K1, from plants, fat-soluble, phytonadione. K3, synthetic. Fat-soluble, medio-acetamiaptho. Water-soluble, medio-sodium bisulfate, medio-sodium diphosphate. Miscellaneous. Fibrinogen. Antihemophilic factor. Desmopressin. Adrenochrome muscimicarbazo. RUTIN. ETHAMSYLATE. Vitamin K: fat-soluble dietary vitamin required for synthesis of clotting factors. Daily requirement: vitamin K2 produced by colloic bacteria and 3 to 10 microgram/day. External source may be sufficient. The total requirement of vitamin K for an adult has been estimated to be 50 to 100 microgram/day. Action: vitamin K acts a cofactor at a late stage in the synthesis by the liver of coagulation proteins prothrombi, factors 7, 9 and 10. Use: vitamin K is in prophylaxis and treatment of bleeding due to deficiency of clotting factors. Utilizatio of vitamin K: absorption. Fat-soluble forms via lymph and require bile salts for absorption. Water-soluble forms absorbed directly into portal blood. Vitamin K1 is absorbed actively, while K2 and K3 are absorbed by simple diffusion. Storage: only temporarily concentrated in liver. No significant stores in body. Excretion: metabolized in liver by side chain cleavage and glucuroid conjugation. Metabolites are excreted in bile and urine. Deficiency: occurs due to liver disease, obstructive jaundice, malabsorption, long-term antimicrobial therapy which alters intestinal flora. Deficient diet is rarely responsible. Most important manifestation is bleeding tendency due to low levels of clotting factors in blood. Hematuria occurs first usually. Other sites of bleeding include GIT, nose, and under the skin ecchymoses. Uses of vitamin K: dietary deficiency of vitamin K. Prolonged antimicrobial therapy. Obstructive jaundice or malabsorption syndromes. Liver disease, cirrhosis, viral hepatitis, response poorly due to hepatocellular damage. Newborns. All newborns have low levels of clotting factors. Vitamin K 1 mg intramuscular recommended routinely. Medio should not be used for this. Overdose of oral anticoagulants. Most important indication of vitamin K. Phytonadione is the drug of choice. Higher doses produce unresponsiveness to oral anticoagulants for several days. Toxicity. Rapid IV infusion of emulsified vitamin K produce flushing, breathlessness, chest constriction, fall in BP. Probably due to emulsion form. Death is very rare. Medio causes hemolysis in a dose-dependent manner. Patients with glucose-6-phosphate dehydrogenase deficiency and neonates are more susceptible. Medio cause characteris in newborns. Note: due to poor efficacy and higher toxicity, there is little justification to use medio. Fibrinogen. Employed in hemophilia, antihemophilic globulide deficiency and acute fibrinogen states. 0.5 mg IV is infused. Antihemophilic factor. Concentrated human AHG preparation. Indicated in hemophilia and AHG deficiency. Highly effective, short-acting. Desmopressin. Releases factor VIII and von Willebrand's factor from vascular endothelium. Checks bleeding in hemophilia and von Willebrand's disease. Adrenochrome carbazo. Reduce capillary fragility, control oozing from raw surfaces and prevent microvessel bleeding. Efficacy is uncertain. Dose, 1 to 5 mg oral, intramuscular. RUTIN. A plant glycoside claimed to reduce capillary bleeding. Used along with vitamin C, which is believed to facilitate its action. Dose, 60 mg BD/TDS orally. Efficacy is uncertain. ETHAMSYLATE. Reduces capillary bleeding when platelets are adequate. Used in prevention and treatment of capillary bleeding in menorrhagia, epistaxis, malaria, etc. Dose, 250 to 500 mg TDS orally. Local hemostatics. Substances used to control bleeding from a local and approachable site. Particularly effective on oozing surfaces, for example tooth socket, abrasions, etc. Substances include fibrin from human plasma, dried as sheets. Gelatin foam. Oxidized cellulose as strips. Thrombin from bovine plasma, as dry powder or fresh solution. Vasoconstrictors like 0.1% adrenally soaked sterile cotton gauze. Astringents like tannic acid or metallic salts. Sclerosing agent. These are irritants, cause inflammation, coagulation and ultimately fibrosis. Injected into hemorrhoids and varicose vein mass. Used only for local injection. The substances include phenol, 5%, in almond oil or peanut oil. Ethanolamine olate. Sod. Tetraedyl sulfate. Polydicol, 3% injection. Thank you for watching.